So I'll start. Welcome, everyone. Our Region 7 Presents topic for today is Funded Project Report Back on Indoor Air Quality Resources. Thank you for being here. My name is Benny Finch, and I am one of the Education and Outreach Coordinators for the Network of the National Library of Medicine in Region 7. And I'm joined by my colleague, Sarah Levin Letterer, who will be helping me manage the chat and moderate the Q&A session towards the end of the webinar, along with our presenters, who I will introduce in just a minute. So before our presentation, I briefly want to introduce the network, also known as NNLM. The NNLM regional medical libraries are funded by the National Library of Medicine, which is within the National Institutes of Health. We are the education and outreach arm of the National Library of Medicine. We work regionally, getting to know communities on the ground and helping those communities serve the people they know best. Region 7 includes those states in the top right of the map: Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. Our office is located at the UMass Chan Medical School in Worcester, Massachusetts. But we're also present across the entire country, and we work to advance the health and well-being of everyone through access and understanding of how to use health information. One of the ways that NNLM has been supporting health information access is through funding. Our presenters today will be talking about their funded projects related to indoor air quality monitoring resources. And again, before we start the actual presentation, a few items to cover. Captioning is available by clicking the Show Captions button. During the session, please do add your questions to the chat, and we will hold those for our Q&A session. And please do send questions and replies to everyone to make sure that we can see them. Sarah will be monitoring the chat again for us today, as I mentioned, and we do send out the recording to all registrants within the next couple of weeks. And today's presentation is eligible for MLACE. At the end of today's session, we will share the evaluation link, which is the first step in claiming continuing education credit. So now we will get started. So our presenters for today are Kate Nyan, Ryan Brennan, and Melissa Canham-Klein. Kate Nyan is a public health librarian and lecturer in environmental health at Yale University. Her work includes evidence synthesis methods, evidence-based public health, and the information behavior of the public health workforce outside of academia. Kate co-founded the nonprofit organization Community Access to Ventilation Information to help Canadian public libraries empower community members to measure and improve indoor air quality with CO2 monitors. In its first 2 years, CAVI gave 300 CO2 monitors to public library systems serving 30% of the Canadian population across 9 provinces and 2 languages. This work unites Kate's passions for health equity, information, and libraries. Welcome, Kate. Ryan Brennan was the interim assistant director for the Public Library of Brookline, previously serving as the supervisor of collection development at the time when this project was initiated. Currently, Ryan is the supervisor of access services at the Watertown Free Public Library. Ryan has worked in public libraries for 16 years in various roles, including public programming, collections, and administration. Most recently, he's been working with Library of Things and Tool Library collections, as well as auditing the library's collection diversity. This project aligns well with that work and Ryan's passion for bridging equitable access to information and resources to the community. And welcome, Ryan. And Melissa Canham-Klein. If someone told Melissa Canham-Klein's elementary school self that she would grow up to be a library director, she would have laughed loudly. Journalism, teaching, pursuing medicine, these were all careers she worked in or pursued. Then she volunteered at her branch library in New Haven, Connecticut, and quickly learned that a library is a hospital for the soul, and that all her previous career pursuits prepared her to serve in a public library. Gratefully, since 2001, she has been mentored and nurtured by awesome folks and has grown her career in library land from page to library director. Along the way, she's helped to steward urban, rural, and suburban libraries in Connecticut. Currently, she is the library director for the Hamden Public Library System. And welcome, Melissa. So today, each of our presenters will share about their projects, and then there will be a moderated discussion. I have allotted time for questions, so again, please add your questions to the chat and we will discuss those. And now I will hand it over to Kate to get the conversation started.
Thank you very much, Benny. Benny and Sarah, everyone at Region 7, and especially Ryan and Melissa, without whom there would be no grant-funded programs to talk back about. I'm so glad that we can be here together and discuss this work that we've been doing for several years now. So thanks very much for giving us something really interesting and rewarding to talk about today. Now, I'm going to set the stage, if you will, with some information about why indoor air quality is important, why carbon dioxide monitors are something that can help us with indoor air quality, and why public libraries are a great setting for health literacy interventions. And how Melissa ended up working, in a sense, in that hospital for the soul with a real health angle. Without further ado, let's discuss CO2 monitors in libraries. So, CAVI, Community Access to Ventilation Information, was founded based on the observation that carbon dioxide is an important measure of indoor air quality, not the only measure, right? But it's one important measure of indoor air quality that tells us how much air from outdoors is coming into a building through windows, through ventilation systems. But it's invisible. You can't smell it, you can't see it. You don't know it's there unless you have some technology to measure it. And most people don't have this technology. So I've co-founded Community Access to Ventilation with two colleagues, an engineer and a public health worker. After the engineer, who happened to have a carbon dioxide monitor already, engineers, right? If only the world were full of engineers. And she took it to a concert. She took this carbon dioxide monitor to a concert at a big club and was unhappily surprised to see that the carbon dioxide parts per million level during that concert in that very crowded space, it went up and up and up and up until it peaked, as you see in here, around 3,500 parts per million. Which is significantly more than the background outdoor level of maybe 400, 420 parts per million. So that means that in this space that you see in the rather blurry photograph that I think is a very good it gives you the vibe of a night out in the bar, right? Or a night out at the club. There was not enough outdoor air ventilation in that space for the number of people and the physically active dancing. You're breathing in, you're breathing out a lot. But the only way you could know that is by measuring it with this technology. So the engineer already had a carbon dioxide monitor that she owned herself, but most people don't. So what part of our society is great for sharing information and tools? It's the public library. So we went to public libraries, first in Canada, and then we found some American partners too. And we discussed the benefits of carbon dioxide measurements. It's a simple metric for one important aspect of indoor air quality. You can use it to understand ventilation rates, ventilation with outdoor air. And indoor spaces that have poor ventilation are spaces where people are at higher risk for transmission of respiratory diseases. That is not just COVID, right? COVID, flu, TB, measles, all of those are easier to spread if someone who is sick, even if they don't know it, even if they don't have symptoms, goes into an indoor space with poor ventilation. Now, infectious disease is not the only reason to be concerned about indoor air quality. I'm sure that you're all familiar with the healthcare burden of asthma or COPD or other diseases that are related to indoor air quality too. So, um, how can people act on this indoor air quality data once they have it? Is it the kind of thing where you know that the situation is bad and you just feel depressed about it? Or is it the kind of thing where knowledge can empower you to take some action? Well, if you are in control of a space with ventilation that's not great, you can start fixing it. You can increase the supply of fresh air. In a car, you can crack the window. You can open a window, or ideally, if you crack two windows in a room, then you can get a flow of air going from one side of the room to another. And that will decrease the carbon dioxide parts per million in that room. It will be very evident on your CO2 monitor very quickly. Or if your concern centers on infectious disease, you can add air filters, and that won't change the carbon dioxide parts per million reading, but it will make the air that is circulating and recirculating and recirculating as people in the room breathe in and out. It will make that air safer. And even if you don't control the space that you're in, if you know that the indoor air quality is not great, if you know that the ventilation is not great, you can try and improve it in some indirect ways. You can inform the person who manages the space that there's a problem. A lot of people don't know what the ventilation situation or the indoor air quality situation is in the buildings that they manage. You could change your behavior about when you come into that space. Maybe you try and pop into the grocery store that has bad ventilation earlier in the day when there's less built up exhaled air from other patrons. Maybe you switch to a different space if you have options, or maybe you decide to wear a mask. Uh, and sometimes I've had this happy experience. Sometimes I take out my CO2 monitor and it shows that a space is actually surprisingly well ventilated. Because remember, it's hard. You can't see it, you can't taste it, you can't hear it unless you have this data. You don't know. So in some cases, I've been really reassured that the CO2 parts per million reading that I'm getting from a CO2 monitor is reassuring me that a space is actually very well ventilated. Now, indoor air quality is an equity issue uh, because populations that are on the rough side, the pointy side of health disparities, are often dealing with environmental justice issues, poor housing stock, and a heavier burden of infectious disease. Uh, and these CO2 monitors, good ones can cost about $250. And that's not a small expense for a lot of people. So we think that everybody should have healthy air and everybody should have information about the quality of the air in their spaces. Not just the people who can afford to buy a monitor themselves, but everyone. So that's where libraries come in. But libraries aren't only places where you can share tech, libraries and devices. Libraries are also places where you can share data, information, and even knowledge. So CAVI curated educational materials that were tailored to the needs of library patrons and which came from reliable sources, especially government agencies and professional societies of engineers. So the programs that were launched in hundreds of libraries in public libraries in Canada, and also some libraries in the United States, they used the Aranet 4 sensor. That's not the only sensor that works. As long as you pick a sensor that has these characteristics in the stars, you want NDIR technology, non-dispersed infrared, and you want some kind of data connection so that you can get historical information so that the library patrons can get information about change over time in the CO2 parts per million readings. You want to make sure that if calibration is required, that it's not complex or challenging or difficult. And you want a device that is tough because I don't know about your library users, but I'm very clumsy and I've dropped a monitor like this many times and it still works. Now, the distributors of the ARANET offered libraries and Kavi too a special buy two, get one free deal on this technology. We've been very happy with the distributor and the quality of the tech, but as long as you keep in mind these characteristics, choosing a different brand would be no problem. Now, here's a distribution of all the many of the different places where people who are public library patrons can get CO2 monitors through their public library. So they don't have to pay for it. They can get educational materials and they can borrow it and check out the situation in terms of ventilation and indoor spaces. And I have also included some reviews, some feedback from public library users, not at the libraries where Ryan and Melissa have some stories to tell. These are from other libraries. Uh, and I am really especially proud of the quote down at the bottom. That's my absolute favorite. This is a terrific device, but the cost was prohibitive for this library user to purchase one on their own. I appreciate the idea of a program like this so much, namely that a public entity can provide a service to people who would not otherwise be able to access it, all at the behest of a committed group of volunteers who know their stuff. I smiled for several days after we got that comment in our in our online forum because I think that's really the central goal of a lot of Library of Things programs to empower people with technology that they might not be able to access or they might not know how to use without a little bit of extra support. Now, I want to invite you to check out our website, cavico2.com. I know it says .com. We're a nonprofit. We're registered in Ontario. And on that website, you can see information about that map. You can see information that's designed for libraries, sort of library-oriented questions. And there's also patron-facing information and our frequently asked questions that have come from working with lots and lots of public libraries. So I invite you to go explore that information and get in touch with us. And now I will pass the mic to Ryan and Melissa to hear about their experiences running this kind of program. Thanks all.
Hi, thanks everybody. Happy to be here today to talk to you about this project a little bit. So I wanted to talk about a few things. One, why we decided to pursue the grant and why we thought this was a good fit. Some information on how it's doing in terms of circulation of materials, and also, how we process them, got them out to circulation, as well as some programming that has continued since we added it. So we decided to apply for the grant. One, thanks to Kate for reaching out to us to begin with to know that it existed. So that was very helpful. But also we felt like it fit with our overall mission of why we have a library of things in a makerspace. And, to learn by doing, but also as an equity issue, like Kate talked about, it can be cost prohibitive. And that's one of the goals of having a library of things. Also, the previous year in the spring of 2022, we had launched a tool library at our Coolidge Corner location, and we thought air quality monitors would be a great fit. We had already had similar items like a thermal gun to see where you're losing heat and might need to insulate better and things like that. So we thought that would be a good fit. Um, and we also had partnerships already with some other organizations around town. We had worked with Mothers Out Front Brookline to add induction kits, as a more environmentally friendly way of cooking. We had also partnered with Climate Action Brookline and the health department on other things. So this seemed like a good natural fit for that. In terms of processing them, they were pretty easy to process. We put them in small sterilite containers. Like Kate mentioned, they're really durable. And just a barcode on the lid, we put a QR code in the container that patrons could both go to get instructions on the app, but also the resources that Kate had showed you earlier, so they could get more information on the importance of these devices and air quality. Um, and then, and then we circulated it with our library of things. We also had it in our tool library binder, so people could kind of get more information on it there. In terms of circulation, they've been doing quite well. As of mid-April, they've circulated about 152 times. We have 10 monitors, and we got them on the shelf in early 2024. So they're doing quite well. Um, for context, the our main library had 5 monitors. Our Coolidge Corner location had 3, and our Putterham location in South Brookline had 2. Um, we actually have almost as many circulations at Coolidge Corner as we did in Brookline Village, even though there were less monitors. So I think that speaks to the fact that having the tool library and folks knowing about that made it an easy transition to use these more, and they're doing really well there. I would also say that so we've done some programming along with it too. We worked with a group out of Northeastern called iSuper, and if you don't know what that stands for, it's Intelligent Solutions to Urban Pollution for Equity and Resilience. Really rolls off the tongue. So we worked with them and did a air quality trivia night, and they're a group that has actually sent CO2 sensors around town for exterior air quality and around Brookline and Chelsea. So that was a natural fit. We also did a program, Intro to Climate Science and Clean Energy, and another program, The Hidden Cost of Plastics to Human Health. And I add those because we use those opportunities to promote the CO2 monitors at those programs. I think anytime you have a program that's even tangentially related, it's a great idea to promote it there. I think we probably have all experienced with Library of Things that it can sometimes be difficult to get those items out in front of people, really advertise them well, and let them know that they're there. So programming that coincides with that sort of thing, I think is a great opportunity to get people excited about them and wanting to use them. And I think that fits, that covers most of what I wanted to say. In terms of lessons learned or anything I would have done differently, probably more programming sooner, and, just constantly making sure that we're promoting them. But we're definitely very happy with how well they're circulating and how much they appreciate them. We've gotten good feedback at the public service desks from patrons, saying that they really appreciate it and have said similar things about, this is something that I really wanted to do or get and test, but didn't want to purchase one on my own. The other thing about Brookline is it is a really health conscious community, and there are also a lot of old properties and buildings. So I think, renters and folks are very interested in kind of getting that information, and this was a good resource for them. I will pass it off to Melissa. Thank you.
Thank you, Ryan, and thank you, Kate. And I want to thank Kavi and then LM for making this all possible. Kavi found us, so thank you, Kate. Kate actually knows one of my trustees, and they connected together and they talked about this, and it just happened to coincide with a giant community needs assessment that the library was going through. And in that library needs assessment, we were trying something very different. Instead of connecting with people who already knew the library. We were trying to reach out to stakeholders, potential stakeholders who didn't know about the library. And so in the course of about 4 months, we held 23 conversations, listening sessions with different groups throughout the town of Hamden, which is about 61,000 people. And it's a very spread out geographical area. And it's very much like the state of Connecticut. We have extreme wealth and we have extreme poverty all in the same space, and not much in between, if you consider the Alice measurements as well. Anyway, through those community needs conversations and our survey that we had, we learned that one of the biggest priorities for people, and this was in 2023, was to improve their health and to have a better understanding of the environment. And Hamden is a very beautiful town, very green, lots of green spaces. If you were to come here and visit, you'd be like, oh, wow, there's fresh water, there's a hill, a mountain called Sleeping Giant. We think, oh, this is a really nice place. And it is. But we also have a lot of older housing stock, and we have a lot of houses that are clustered together. And a lot of the people who express that need for better understanding of environment and health were coming from parts of the town where that was more of their life, where they had very crowded neighborhoods. And so we have the 10 air monitors, and we pretty much have put them in equally distributed. Our main branch has 4 of them, and our 2 other branches have 3 of them. And both of those branches are in what we call Southern Hamden, which kind of borders near New Haven, Connecticut. And the way it works is in Connecticut, anybody can borrow from another library, anybody could place holds. So these are not just limited to Hamden residents, they also go to anybody. And so we have some crossover between people who live in New Haven as well as in North Haven using the air monitors. In Hamden, to receive any grant, no matter what the amount of money is, we do have to go before our legislative council and get approval to receive that money. It's to make sure that we're not obligating the town to something that the town can't fulfill. And so I was a relatively new director at the time and got very nervous about this. But one of the things that really helped was to point out that our community needs assessment really backed up the fact that the public wanted more health education and they wanted more control over their own health. And that impressed the legislative council, and they permitted the grant to go through. So we were very happy. One of the key elements to making this really work for our public was we had Kate come in on a staff day, well, not our annual, but we have a monthly staff meeting, an all staff meeting, and we have about 40 people on staff. And Kate came, and we were in a very crowded room. We probably should have had a CO2 monitor for that room, Kate. And she walked us through everything about CO2, why it was important to monitor it. And one of the things that really got our library staff was the correlation between dementia and CO2 levels, and air quality, I should say. And that's because a lot of us are of a certain age, so we pay a lot of attention to that. And people are like, oh, this is very, very important. At the time, Kate also showed us how to make our own air filtration system, and it was very exciting. So I do know that there were staff members who went home and made their own air filtration system, so that if you found out that you did have filtration problems at your home, you knew how to take care of it. And so that was very exciting. Replaced, we had a whole bunch of old CD cases like this. And so we placed them out with our Library of Things, and our Library of Things went live in the summer of 2023. And it's empty inside, but you bring it to the desk and you check out the air quality monitor. What you get with that is you get the monitor, a nice carrying case. You also get a quick start guide. You get the batteries to operate it in case something goes wrong. You get all the information that Kate was talking about. We printed it out and we included it. And you also get the configuration pin so you can operate it. As soon as we put it out, we had what I think is one of our most exciting success stories. A teacher who doesn't teach here in Hamden, but lives here in Hamden, said, I just got moved to a classroom and I don't like the way I feel by the end of the day. I just feel kind of this. And I don't think it's the school, the kids, or anything like that. I think there's something wrong with my classroom. So he checked out the monitor and he set it up, and it was extreme. The results that he had showed that there was really hardly any ventilation going on in that room. And it was one of these schools that were built trying to be riot proof, so the windows don't really open, whatnot. So he was very concerned about that, and he was able actually to get the teachers union in his school with that information to petition the school administration to do something about the air ventilation in the school. So I thought, wow, that is fantastic, and that is the power of information and empower people's lives. And then just last week, as I was thinking about today, we had another success story, and it's a little bit more library specific. We keep one of these set up in each of our branches because our branches date back to the 1950s. And sometimes I think that's what their HVAC systems also date back to. Last Wednesday, we had a very, very busy day at one of our branches, extremely busy. We had 3 programs going on at once. We had people coming in to use it. It was the evening. Our evenings can get very hectic in our branches because that's when working families can go to the library. And the monitor went off. And at first, the staff didn't know what it was. And people were kind of like, what is that noise? But then when they discovered it, it was almost up to 3,000. So it was in the reddish oranges area, and the staff was like, oh no, this is bad. But it all worked out because this is luckily a branch that has windows. And we did call our public works department because we had been having heating problems as well that week. We did have a company come out just to take a look to see how the ventilation was working in that branch, and we had to close the branch for Monday so that they could come and do that work. But everything's good now. The ventilation is working the way it should be working. The staff knows they can open the windows, and we're so happy that the library was so well used that day. That was like a rock concert. So that is one of our success stories to go along with that. I would say that our circulation is not as much as I would like it to be. When I hear Ryan's, I'm like, oh man, that's so good. Our circulation is about 50. It's right around 50. And I think one of the lessons I've learned about that is, again, it's hard sometimes to advertise what you have in the Library of Things because people really think of libraries as books. And our Library of Things, we just bought a new system that we're going to be using to advertise what we have in it. So I think that will help things go out. And we just hired a couple of people who are really interested in doing citizen science. And this goes right along with citizen science. So I think we're going to be pairing it with that and showing how people can participate in citizen science using these, and also how to make their own air filters like we all learned. So it's pretty cool. And that's about what I have. Thank you.
Thank you all. It's great to hear these success stories. It just, it feels really good. And it does also, it's scary that that alarm went off, and yet no one would have had any idea, right? So by having that information, they could take action and do something. So that's amazing. Yeah, thank you all. If anyone has any general comments of our presenters, you're welcome to, but I will also, Melissa, you shared about the process of, having to bring the grant, so the award, back to your town and get approval in that way. Would anybody be interested in talking a little, if you can remember, I know it's been a little while, about the process of applying for funds and what that was like for you? I'm putting you on the spot because I did not discuss this question.
So I worked on both of the applications with Melissa and Ryan, and I found that it was a really rewarding experience to take the NNLM Region 7 materials, or maybe their National Training Office materials, I don't know. There were great sort of handbooks and guidelines and advice in both written and recorded webinar format about putting together a competitive proposal that gives the team reviewing the proposals enough information about your plans um, to make a good judgment about allocating this money to where it will do some good. So I found that the application process was pretty lightweight from my perspective. I'm not talking about the approval process within the institutions, but on the NNLM side, I thought that it was pretty lightweight and there was help available every time I had a question or thought, what's the best way to proceed about this? And I'll also comment that volunteering to serve as a reviewer for NNLM grants, which I actually did after we had submitted some of our own, that was also really interesting and gave me a real appreciation of the breadth of different kinds of projects that that librarians in our community are working on. So a little plug for that. And Benny didn't ask me to say that. That's completely grassroots. But I think that Ryan and Melissa will have some insight into this from their perspectives as the host organization too.
Yeah, I would just add that, Kate was really instrumental in our application and that made things much easier for us. We didn't need to get additional approvals due to the size of the grant, so, most of our work came afterwards, but I also did not find the reporting requirements to be onerous in any way. So it was just a win for us all around because they're doing really well. Have had some great programming to go along with them. And it didn't, aside from getting them ready for circulation and getting them out there, it wasn't a lot of extra work on my plate to report out to NNLM. So yeah, I would definitely recommend it and keep your eyes peeled for opportunities.
I would second everything that has been said. It was extremely easy. Kate did most of the heavy lifting. The thing that I think really helped with me being able to get both my town's legislative council and also our trustees on board with the grant was the fact that we had a community needs assessment that showed that people wanted this kind of information. That was a big help. I always try to tie things, services back to what we find in our community needs assessment in our strategic focus plan. So that fell right into there. Kate was fantastic at putting that in with the grant, with the application. And I want to say everybody at NNLM was very patient. I'm not always the most responsive person. We only have 2 administrators for the whole system, and it always seems like there's something going on that well, you know how it is, a fire. And everybody has been extremely patient and kind and helping explain things. And it's just been a fantastic relationship and so easy. And thank you.
Thank you. And we appreciate you so much. And we know that you're busy. People are really busy. And so we do our best to keep those reporting things to what's manageable. So I am not seeing the chat, but it looked like maybe some questions came in. Sarah, is there anything?
There are 2 questions in the chat. The first one, I think, so Ryan started out talking about some of the existing partnerships that fed into this. And so there was a question about specifically mass blocks, which is actually something I had never heard of. So I really appreciate the asker put a definition. These are mutual aid groups that provide free masks and COVID tests to the community. And so Hannah was saying that she thinks that they would be glad to know about these and that might be another partnership. But, going off of that, are these, Ryan mentioned some partnerships, what else? Is there anything else to expand on that? I'm going to expand on Hannah's question.
So thanks for that question and suggestion, Hannah. I think that that could actually be a great way of doing some outreach, marketing, publicity. I think that the people involved with mask blocks are the same people who, they could demonstrate how to build a Corsi Rosenthal box, a DIY air filter that is, very well attested to in terms of performance and safety. So I think that that kind of group could be a very good partner for libraries that have this kind of environmental health literacy programming going. Uh, as to CAVI has been able to work with in particular with the Canadian COVID Society, so not a mask block per se, but another civil society group with a focus that is not restricted to indoor air quality, but is focused on the larger issue of uh, inclusion and safety in the community. So that's been a pleasure on the part of CAVI.
So then the other question was for Ryan and Melissa, some of the more pure logistics. How long do the monitors circulate for? And do you allow holds on them? Like, what does that sort of look like in the system that you've set up?
Sure. Yeah. So we circulate them for 2 weeks. We allow renewals. We allow holds. You don't need to be a Brookline resident to use them, but they are local pickup. We don't put them in delivery or anything. And also, depending on what you use for a public-facing catalog, we use Aspen and Minuteman Network. We also had the ability to upload photos of it, so I find that that was also really helpful for when people found it in the catalog and were able to kind of see what it looked like. So yeah, that's what we did for it.
We're very similar. Ours goes out for 3 weeks and you can place holds on it if you wanted to. And again, as I said before, anybody can check it out. We won't put it in interlibrary delivery. So we do ask that if people want to use it, they need to come to one of the locations to pick it up. And we ask that people bring it back to the location, so nothing in our book drops, because we want to protect it that way. And we don't have we use Sierra. We don't have the pictures in our, and we also use Pica. We don't have the pictures in the catalog. But what we do have is on our webpage, we have a whole thing about the Library of Thames, and we have a picture there and a description. And we find that actually our Library of Thames, we take a look at it, our website analytics every month, it gets a pretty high hit. So I think people are going there to find it. I don't know if they're interested in air quality and going to the page, or if they're interested in our pizza oven, which seems to go out pretty often too. But we do have it on the page there with a picture and talking about how it can be helpful.
And I'd like to jump in on the circulation period question. It is possible to set a circulation period that is too long. And we know this at CAVI because our friends at the Edmonton library system, they launched with, I think it was like a 2 or 3 month circulation period. And 4 weeks after they started circulating monitors, they had 120 holds. So I think that the sweet spot might vary depending on how many monitors you have and how much use they're getting. But I think that there's a lot you can learn from cycling through normal, your normal life. What's it like in your car, your public transit setup? What's it like in your home, in your workplace, in your religious settings that you go to, the kids' gymnastics class? You have a monitor for a few weeks, and then you can get insights like, oh, maybe I should crack the window when I'm carpooling, that you can continue to apply even when you don't have the monitor around anymore. So this is not like a carbon monoxide alarm, which really needs to be permanent. And if that alarm goes off, then evacuate the building. This is completely different. Carbon dioxide, different, different gas. And I think that a period of 2 or 3 weeks is a great loan period that can allow people to really play with it, explore their environment, learn some things, and then bring it back so the next person can take advantage of it.
And just going along with that, Kate, I know that from a couple of people who are taking it out, they took it on trips with them because they were concerned. One was a cruise ship. They were concerned about the cabin that they were going to be in at the cruise ship. And the other person was going to be in an RV. So they were just concerned about that. So yeah.
That's so interesting. What was the cruise ship passenger planning to do if the ventilation was not good?
I don't know.
Stay on deck all night?
That's a good
It's just
question.
once you're on the cruise ship, you're kind of on the cruise ship.
Yeah. There's been such bad publicity about health concerns on cruise ships. So I think they were like, I'm going to take this.
One of the things that I've been hearing as you've been talking is just the importance of knowing your community and what they need and what will work best for them. And I've heard this in a few different ways in terms of partnerships and the community needs assessment and really getting, you know, hearing a lot of different voices on what people are looking for and how the library can support that. And the other thing is just even in how you provided the health information. Like one library used a QR code, the other printed the information and put it with, this is more just a comment, like not really a question, but I'm just thinking about the importance of knowing your community, knowing your audience, knowing what's going to be most helpful to people. And if somebody wants to comment, please do.
I think that knowing the audience or the target market really is very important. And that's something that, as the kind of organization that CAVI is, we can't know every community in across the geographic terrain that we cover. So we really depend on the partners at libraries like Ryan and like Melissa to have that insight into their particular library user group. Whether, in some cases that might be elderly people. In some cases, you want to make sure that you have materials available in Spanish, or for a lot of the places CAVI works in French. Um, there's also some concern about making sure that people are empowered to interpret the numbers that they're seeing and then act on it. It's just, if there's a library that circulates blood pressure monitors, right? It's the same kind of problem. There's really valuable information, but data without context is not actionable, and that's the kind of health literacy challenge that is part of this kind of programming, I think.
So I'm also going to bring that back to the disembodied voice is going to bring that back to the discussion about the grant writing process as well, because every grant is going to start with that evidence of need and background section. And so that's asking, why are you proposing this project? What are you seeing in your community that needs that? And so and that can be anything from, a needs assessment that was done at the hospital level or the public health level, or it could be, the reference questions you're getting. If you're getting a lot of questions about a certain health topic, that is an evidence of need for a grant like this. So one question about PowerPoint slides and if those will be shared.
Yes, as far as I'm concerned, yes.
Yes, and definitely if you think you would like them go ahead and send me an email. I'll put my email in the chat in just a second, and then we'll figure out how to get those to folks that are interested specifically.
Benny, is it okay if I put a link into the chat?
Sure. Yeah, that'd be great. Thank you. That's perfect. And are there any other questions, Sarah?
That is what we have now.
Okay. I am gonna well, actually, would any of our panelists, is there anything else you'd like to share before we start kind of closing things down? It'll still give people another minute or two to ask questions, but is there something you think we want to make sure everyone hears today before I start?
I just want to say that it was a real thrill to hear these success stories from Brookline and Hemden. You know, that story about the teacher using this monitor to gather data to bring to the organization, the union, and the school administration to make a better environment, a better workplace for the teachers, and a better learning environment for students. That's just really a great achievement that was only possible through the library. So, what a great story to hear.
I would just add one of the things that we have experienced, and I don't know if you've experienced this, Ryan, is people confusing carbon dioxide with carbon monoxide, and they get really scared and nervous. And so we have really learned to, one of the lessons I learned was you really have to spell out the difference. The CO2 is this, that's what this does. So yeah, that was just another thing that was really important.
We haven't run into that much, but one thing I will add, you know, Kate had talked a lot about kind of things to look for and what was a good monitor. For the AeroNet 4s, if you have it on the 10-minute auto refresh, the AA batteries should last 6 years. And for anybody who's kind of dealt with Library of Things and those little issues that come up, having stuff that you can just circulate and not worry about things like that is made it a lot easier as well.
Yeah, that's a great point. Things that those of you who are circulating these things are thinking about more. It's good to keep in mind. All right, I'm going to share my slides. It looks like Sarah's dropping some links in the chat, but I just want to go back a second. Yeah, I really want to thank Melissa, Ryan, Kate so much for your time, for this these great projects, for the work that you've done to promote them, and just we're really appreciative of the important work that you're doing and for your willingness to share about that with us